Hello, I'm Dr. Dooley, a board-certified psychiatrist practicing in Georgia. Today, I wanted to give a brief overview of how a psychiatric diagnosis is made. There are a great deal of misconceptions about how mental health disorders are diagnosed, and I thought it would be helpful to give these insights. So first is the DSM, this book. This stands for the Diagnostic and Statistical Manual. So it is the reference book for official criteria for mental health disorders. And while there are other ways to diagnose mental health symptoms, this is the standardized book that most psychiatrists are going to be using. Next comes a clinical interview. So in a clinical interview, a psychiatrist will ask you questions about your mental health and often physical symptoms as well. An initial evaluation usually includes questions about your past psychiatric history, medical history, social history, and psychiatrists also use observation of your physical presentation. So is the person restless? Are they having visible tremors? Are they making good eye contact? Do they have facial expression? And sometimes in a face-to-face evaluation, a targeted physical examination may be performed, or the doctor, for example, may have you walk in the office to assess your gait, how you're walking, to see if there's a sign of any other kind of condition. And then next we use self-report questionnaires. So questionnaires are typically check box forms, and they have different symptoms, maybe anxiety symptoms, depressive symptoms, and they're used to kind of see how the patient views the severity of their symptoms. And sometimes we also use these to monitor a person's response to treatment. So for example, I might give one before I start medication and 6 months later to see if the symptoms have changed or the quality of the symptoms have changed in any way. The next thing we may do is order labs, imaging, or possibly other tests, such as an EEG, which tests for seizure activity. We may order those to help rule out an underlying medical condition as the reason or a contributor to your mental health symptoms. So for example, we might order labs to assess for thyroid function, vitamin deficiencies, anemia. These are just some examples of conditions that can mimic a mental health condition, or maybe they may exacerbate a mental health condition or behavioral problem. So it would be important to treat those if we do find an underlying condition that's not psychiatric. Sometimes also we may refer a patient for neuropsychological testing. So this is testing performed by a neuropsychologist, a specialized psychologist, and typically we're using this to help gain understanding of cognitive functioning. So when I say cognitive functioning, I mean how a person thinks and processes information. So this kind of testing can be helpful after a stroke or traumatic brain injury. It can also be used to help diagnose or help us clarify a symptom like ADHD, or maybe if a person has a personality disorder or psychosis and we're still having trouble kind of clarifying the diagnosis, neuropsychological testing can be helpful. And often in our practice, we may need specialty consults. So again, sometimes a specialty consult is needed to help us get a better understanding of how a medical or other non-psychiatric condition is contributing to their mental health presentation. So in my practice, I often, have consultations with primary care physicians, internists, gynecologists, neurologists, endocrinologists. That's just an example of a few, but that's also really helpful. And we may next also seek collateral information. This is information from friends, family members, associates that can help us either confirm the patient's report or provide maybe a different view of how the patient is doing, because some people have trouble really understanding how their behavior either impacts other people or what it looks like to other people from the outside. So collateral information from others can also be helpful. And lastly, if we have a difficult case, we may ask for consultation. So a consultation is basically a discussion with someone in your specialty or maybe in a more specialized area of your specialty to help you get more clarification or maybe a second opinion. So for example, in my practice, I do not often see people who have a diagnosis of autism. And so if I did run across a patient who had an autism diagnosis, I might consult with maybe a child psychologist colleague. And consultation can be pretty informal, just like a discussion to get, like I said, a second opinion or more insight, or it can be formal where you will actually pay someone to kind of sit down, talk to you, and possibly give you, directions on a case. Well, I hope that this overview of how psychiatrists typically diagnose patients was helpful. If you're a colleague, if you're a doc or mental health clinician and you use another means of diagnosis, please feel free to comment that down below. And if you do have questions about the process, also please leave a comment. I hope you're having a nice weekend, and I will talk to you soon.